Hello, my name is Jenna Lynn. I'm going to be your
Hello.
student nurse today. Could I see your wristband, please? And could you give me your name and your date of birth?
Kasia Satowski, 12/29/98.
Perfect. And Kasia, have you voided or gone to the bathroom in the last few minutes?
Yeah.
All right, you don't have to pee right now?
No, I'm good.
Perfect.
Bladder's empty.
All right. And I can see that you already have your hospital gown on right now, so we'll go ahead and get started with your assessment. I'm going to start with your pulmonary assessment. So I'm going to have you sit up for me. And I'm going, is it okay if I lower your gown?
Oh, yeah.
Okay, and I'll have you swing your legs over the edge of the bed here and face me. Perfect. Okay. I'm going to assess your abs, your chest. I'm going to palpate it for any crepitus, masses, thrills, and everything feels normal. All right, and then I'm going to percuss your chest. Okay, let me go under here. On this side, and up here. All right, everything sounds good. Going to check for your diaphragmatic excursion. Make sure that your lungs are both expanding equally. Could I have you take a deep breath in? Good. One more time. Perfect. All right. I am going to listen for your lung sound. So I have you breathe in deeply. Good. 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 Don't want you to hyperventilate, so just take it on your time. There you go. Good. One more time. Good. Perfect. One's on this side. Good sounds. Good. And two more times. One's here and one time up here. You have good breath sounds. I don't hear any gurgling or anything in your lungs, so it sounds like your lungs are clear. All right, and I'm going to have you turn around for me, and I'm going to assess the back side of your chest. Move your hair out of the way. I'm going to palpate for, again, any masses or crepitus, and I don't feel anything. Everything feels all right. Do you feel any pain or tenderness?
No, that's very nice.
Okay, perfect. And I'm going to do diaphragmatic excursion on the back as well. Can I have you breathe in? Good, even on both sides. All right. Actually, I'm going to palpate first before I auscultate. Gonna auscultate and then have you do the breathing in again. Good. Again. Good. Oh, that was a good strong one. Again. Good. Good. 3 more times. Good. All right. The last thing I'm going to do is check your diaphragmatic, I believe it's called diaphragmatic excursion, right? Okay. Yes. All right, I'm gonna have you breathe in and hold it for me. I'm gonna percuss. Right there. The lowest point. Okay, you can let your breath out now. Sorry about that. And then I'm going to have you just breathe a little normal right now. And then when you're ready, breathe out and hold it. Okay, definitely down here. Okay, go ahead and release your breath. Go right there. And I'm going to do it on this side too, so breathe normally. And then breathe in as hard as you can and hold it. Try it here. Okay, let it out. Sorry. Alright, and then I'm going to have you breathe normally, and then breathe out and hold it. So right here. Okay, breathe normal again. Go ahead and measure those. Okay. Good. Perfect. Alright. And I'm going to have you turn around again. Alright, and you can go ahead and put your gown back on. And the next thing I'm going to do is assess your cardiovascular system. And lay down, relax, and bring your gown down. Alright, you comfortable?
Mm-hmm.
Alright, going to palpate first for your second right intercostal space for your aortic. Good. And then I'm going to move straight across to the left second intercostal space for the pulmonic. And then third intercostal space. Good. Also known as Ebb's point. And then I'm going to lift your bra for a second, and I'm going to do your fourth intercostal space. So the tricuspid. Good. And then the last one is the fifth intercostal space, and that'll be your mitral. Good. And then the precordium of your heart. I'm going to palpate it here in the left sternal border. And while I'm doing this, I'm also assessing your chest for symmetry, color. Everything looks good. I don't see any scars, masses. I didn't feel anything while I was palpating. I'm gonna go ahead and listen to your heart. And this is a cardiac stethoscope. So when I put it down lightly on one point, it's gonna be using the diaphragm. I'm gonna be listening to your heartbeat. Then I'm gonna put some pressure on it, and then it's gonna switch to the bell of the stethoscope, which will allow me to hear the thrills in that area, or if there are any thrills or bruits or anything like that, okay? So I'm gonna start again at the second intercostal space at the aortic. So I'm listening with the diaphragm. Good, strong heartbeat. Press in a little bit. Ooh, very nice. No bruits. Move over to the second left intercostal space. That's the word I was looking for. Listen to the heartbeat. Press in a little bit for the bruits. See if there are any. Don't hear any. Good. And the third intercostal left space. Good heartbeat. Press in here. Use the bell. Nothing abnormal there. I'm going to lift it up a little bit. I'm going to listen to your fourth intercostal space. Good heart sounds, and then push in to listen for any bruits. Everything sounds good there. And the fifth intercostal space is the mitral. Listening to the heartbeat, which is very strong here. Push in and listen for buoys. Everything sounds good. Alright, and now I'm going to move on to your abdominal assessment. I'm going to cover you up, and then I'm going to expose just your abdomen. And I'm going to get a pillow and place them under your legs. So if you could, yes, perfect. Raise your legs. I'm going to put this pillow under and just relax. Good. Alright. You have good color in your abdomen. Hair's growing the right way. I don't see any masses just by looking at it. No scars, no bad coloring. Everything looks even. I'm going to look for symmetry to make sure that your belly button is lined up with your nose. And it looks like it is. Perfect. Alright, the first thing I'm going to do is I'm going to auscultate your abdomen. I'm going to listen in all 4 quadrants, starting with the right lower quadrant. I'm just going to be listening for how active your bowel sounds are. Would say hypoactive bowel sounds in this quadrant. I'm moving to the right upper quadrant. Normal bowel sounds in the right upper quadrant, moving to the left upper quadrant. I'd say in between normal and hyperactive bowel sounds. Here in the left upper and moving to the last quadrant, left lower. And I'd say hypoactive sounds for the left lower quadrant. Alright. The next thing I'm going to do, actually, I need this again, is to auscultate your different arteries. So I'm going to start with the aortic artery. Good, I can hear that. And I'm going to also listen for bruits by activating the bell. I don't hear any bruits. Alright, I'm going to do the right renal artery. Good, good sounds. The left renal artery. Femoral arteries. Good. The right iliac artery. Good sound. And the left iliac artery. Now I'm going to percuss your abdomen in the same pattern of the quadrants that I did before, starting with the right lower quadrant. And here I'm looking for any abnormal dull sounds where there shouldn't be. Make sure there's no masses. I don't hear anything. In the right lower, moving to the right upper quadrant. Good resonance. Right up where your liver should be, there's some dullness, which is good, which means your liver is in the right place. Moving over to the left upper quadrant. Good resonance down here. A little bit of dullness up in here where your spleen should be, which is good. And I'm ending in the left lower quadrant, and I'm not hearing any dullness. And do you have to pee at this point? Is it okay if I percuss your bladder? Alright. Okay. Good. Perfect. Alright, next thing I'm going to do is palpate those 4 quadrants, just to feel for any. I'm going to start with light palpation. Just going to feel just any abnormalities. Everything feels smooth in the right lower quadrant, the right upper quadrant, Good. Left upper quadrant. And the left lower quadrant. Don't feel anything abnormal. Good. And I'm going to palpate a little bit deeper into each of the 4 quadrants. No abnormalities there in the right lower. I'm moving to the right upper. Don't feel anything abnormal here, which is, of course, a good sign. Moving to the left upper quadrant. Left lower quadrant. You feel any pain or tenderness anywhere with this? Alright. Good. Alright. I am going to attempt to assess your liver span. So what I want you to do is I want you to breathe out, and I'm going to feel the very bottom of your liver. First, actually, I'm going to palpate. Actually, this is palpating for to see whether your liver is, we want to feel a firm liver with no nodules on it. Because you have a healthy liver, and I feel a firm liver. It's smooth. It's good. Alright. Now, I'm going to progress your liver span. I'm going to start up here, and I'm going to move up. Resonant. Say right there. Here. I'm going to measure that. Good. The liver span is normal. You can go ahead and put your bra down. Alright. And the last thing, let's see. Last thing I'm going to do is I'm going to have you sit up. And I'm going to press your costal vertebral angle. And let me know if you feel any pain with this. I'm going to put my hand over your kidney area, and I'm going to pound on my hand. Do you feel any pain?
No pain.
Good. Perfect. All right, I'll have you lie back down. And I have completed your abdominal assessment. You feel okay? Everything feel good?
Mm-hmm.
All right. I will be back. And let me know if you need anything. Your call button is right here.
Jello.
Jello? Okay.